Hi, I'm Syeda Jafri. Welcome to RUSD Bridge. On this episode of Escape the Vape, we have two very special guests in our studios. Chief Gordon Leary, he is our Rialto Unified School District School Safety Chief, and also Mirza Martinez from the San Bernardino County Central Valley Health System. So welcome both. Thank you for being here. Of course, mental health, extremely important, especially in times of the pandemic. And Chief, thank you for being here as well. I want to first start off on what do you exactly do for the Central Valley mental health system? Mirza?
Yes, so I'm a prevention specialist with mental health systems. Central Valley Prevention Program is a program of mental health systems. And our mission is to work with community to reduce underage drinking, smoking, and other drug use in our service area that's assigned by San Bernardino County. So our service area consists of the cities of Bloomington, Grand Terrace, Colton, San Bernardino, Rialto, and Muscoy.
Okay, so that's a large area, regional area. And where do you see the problem with, because there's a segment of society that wants to say there isn't an epidemic of vaping, that it doesn't exist or is not as much, or it is as much. And we'll talk to Chief Leary in a minute more about that locally for Rialto. But do you have statistics or do you have anything nationwide or regionally on, is there an increase or a decrease, especially during this pandemic?
Yes, and what I will always say is when we're looking at the issues associated with underage smoking or any other kind of drug use, the best thing to do is to look at the data, just exactly what you said. Where do we pull this data from? From community. So anything that is a survey, a focus group, that in the future, I think we also need to be educated at what it means to take a survey, what it means, what does it mean when you're participating in a focus group? Well, it helps programs like ourselves and funding, design the programs that fit your community. So looking at the data, when it comes to vaping, we have, I think the 2017, 2018 is the latest report that we have from the California Student Tobacco Survey. And this survey found among 15 schools that were selected in the county that vaping was a problem. And that's according to students self-reporting on the survey. Out of those students, 87% of them reported using flavored tobacco products, with the vaping devices. So, and that is very alarming because we are looking, last year, we conducted a survey, just an opinion poll, because we do youth development events. And every year we try to ask, leaders in our service area to contribute to the poll. In the poll, we actually surveyed 67 community members that are actively participating in the coalitions to reduce underage drinking, smoking, and other drug use. And so out of the people that participated, 57 of them said that they would like to see an event for youth focusing on vaping because that was a major concern for them. One, they didn't know enough about it. Two, they were just seeing it everywhere. And three, they were getting information from youth that youth themselves were getting out of just, community sources. Nothing that was scientific. There was so they wanted the conversation. We conducted last year in October during Prevention Month an event that was called Escape the Vape. It was on a Monday. That's the day they chose also through that opinion poll. And 202 people showed up to that event. Wow. Out of the 202 people, 97 of them were youth. And the event...
97 of them were?
Youth. They were young people.
Young people, okay.
Yes. So the great thing about that is that the participants, and I know that Rialto Unified was represented on that day, and we left it up to the youth to actually do the presentations, and it was great to hear them tell their stories about what they were doing in their communities to escape the vape.
Now, I have to ask Chief Leary, there is a partnership here.
Yes.
Can you tell me about the partnership and also obviously you're the school chief for 29 schools, so you have officers pretty much stationed at the schools, along with patrol and prevention and community outreach, and there's a lot that's going on with Rialto safety officers. So do you see a problem? Is it growing? Is it upcoming? Because before it used to be, I believe, marijuana, kids call it weed or dope or whatever. So vaping, is this the new trend in the last couple of years, or what's going on with that?
Yes. If you're not aware, the Center for Disease Control has labeled vaping as an epidemic in our country. So that would be also inclusive of Rialto, that we are impacted by that. We're taking this very seriously, so what we're trying to do is be proactive on every level and every level of engagement within the community and with our students. One of the things that we're proud to announce that has taken place this year in the month of March is that Rialto Unified School District is now considered a tobacco-free school district, which we've received the certification from California Department of Education. What that means is that we've met specific criteria at the level of at the state level that they require for all public schools. One of those criteria is that we have to have a policy and procedures in place that specifically mentions what we are going to do with regard to how we're going to do intervention and be proactively engaged with e-cigarettes or vape pens or hookah pens or tobacco-based products in general.
Can you go back really quickly, because we have some of our viewers and our parents who are watching. What is a hookah vape?
These are electronic, the new trend you had mentioned earlier about is there a trend? Mm-hmm. The trend is the e-cigarettes, the electronic cigarettes. Mm-hmm. Hookah pens, vape pens are all part of these tobacco-based flavored types of electronic cigarettes that are targeting youth in particular. The tobacco industry has long been an industry that is known for its predatory marketing of our youth and focusing on different ways to subliminally or to in a very subtle way to attract them. So the product is designed in such a way that it is alluring and is attractive to teenagers. Mm-hmm. And so the product doesn't necessarily smell like tobacco. It smells like something sweet, smells like something fruity.
So there's that hook, like it smells fruity or it smells like something that's more desirable. So I do have to ask you, because I've spoken to some parents in the school district and they don't see vaping as dangerous as smoking. Some of them even say that, well, my child told me that it's not real tobacco. Is any of that true?
Yes, I think that we see a growing trend when Chief was talking about interventions. Mm-hmm. There's that individual aspect of the strategies that we use to do individual interventions. Those usually happen in the family setting, in the school setting, in the faith-based setting, in the healthcare system, that we try to look at the individual and we try to inform him and we try to do as much education as we can. And then the environmental aspect of it is that the culture, it's the perception, it's how the norms, regulate the behavior of people and what is popular and not popular. Then there's legality aspects and are these products being regulated at local level? And then there is the accessibility issue. So when you put all that together, it's a very confusing world for youth. Now, what we're hearing and what parents may be hearing out in the community is that it's less harmful because it's a vape. It's better than smoking cigarettes. They have no information. No, actually, when you look at one of the strategies that the tobacco industry has used, that is that in the juices you don't have the ingredient labels that actually tell you, what is exactly in those liquids, and some of them contain such a high concentration of nicotine that they could be equivalent to 2 packs of cigarettes. And what happens when a youth goes and they have a kickback on Friday and they go through the whole liquid, they just smoke 2 packs of cigarettes.
Wow.
Do people know that? Do parents know that? The information that parents are getting typically is coming from the social norms that make it popular. It's coming from the youth making a case that, hey, this is not harmful.
Yeah,
and
sometimes
then parents
students
are
or
okay.
sometimes children do tell their
Yes.
parents something, and sometimes parents are gullible. When I was a child, I would tell my parents something, hoping that they'd believe it with 2 fingers crossed. And so now
Yes.
when it's talking about drugs, because vape is a drug.
Yes.
Right? I mean, there are people who
Nicotine,
don't think
yes.
it's as dangerous, like you mentioned. I do want to ask, Chief, can you give me your history with the Rialto Unified School District? I know you sit on the superintendent's cabinet, so once a week you fill the superintendent at the central office about things that are going on, and a lot of people don't know that behind the scenes. But what is your role? Where did you start? What's your history with RUSD?
I've been with the district now for 29 years. I started off as a campus security officer, campus patrol officer, and a district lead safety officer. For the last 10 years, I have been in the position of the chief of the safety for the school district. In that position, my primary function is not to just simply install officers at different campuses, but to look and to think more intimately in terms of what it is that is affecting our campus in a negative way, and what can we do as a department to be more directly engaged with our students. So one of the things that we're doing now as a department, and I'm very excited about that, is that we're moving more into positive behavioral intervention and support, which is what
PBIS.
the acronym for PBIS.
Right.
Our officers are now more engaged in direct training that will allow them to be more influential, impactful in the lives of our students.
Beautiful.
That would be such things as bullying intervention, anger management intervention, drug and alcohol intervention.
So this is all restorative justice.
These is all restorative practices that our officers are now moving into. Even the name of our department, which many don't know, the official name of our department now is the Safety Operations and Intervention Services for the district. Our officers are now considered safety and intervention officers, whereas before they were safety and security officers. We're trying to rebrand ourselves, not just by the title, but also by bringing in and bringing in more training for the officers so that they can be more effective in their role in intervention with the students.
And so 21st century education, you want that kind of problem-oriented where your officers are more like role models and
Yes.
education safety officers that are assisting students rather than the top down, the hatchet, you're in trouble, you're in
Right.
trouble. So that's wonderful. And you're doing that through training.
We're doing that through training. That's more directly related to what we're talking about here today as far as the vape program and tobacco intervention. I'm really excited about the fact that we have just received a tobacco grant in conjunction with, linked up with San Bernardino County School.
And so there's the congratulations for that,
Yes.
because you are an award-winning department. And talk to me a little bit about this grant.
The grant is the TUPE grant. It's the Tobacco Use Prevention Education Program that is available to any school within San Bernardino County. Matter of fact, any school in California can apply for this grant. Now, what makes this so exciting to talk about today is that out of all the schools in San Bernardino County, Rialto Unified School District is one of the 7 schools. Only 7 school districts have received this grant, and we are one of those 7 school districts that was awarded this grant. What this grant will do is that it will provide us with the necessary funding and resources, training and funding to be able to directly impact our youth and parents and the community with education, being more informed, being more educated, and making sure that our students are in a position to make a more healthy, right decisions about how cigarettes, how tobacco-based products in general can impact them not only now, but overall because of its effect on their emotional, on their social, and their physical well-being.
So where did you get your master's in?
I got my master's in counseling at the Azusa Pacific University.
I see it, because you're already ready to make that change in that student's life, like you foresee these things. So that's wonderful.
Yes.
So my question to you would be, and I'm going to get back to this partnership here with
Yes.
Escape the Vape.
Yes.
My question to you is, What are we doing with the Central Valley mental health system leadership with the representative? How are we going to do this during the pandemic? Because obviously there was a problem before. Do you see a decrease, increase? How do you have the data to know, are students quietly vaping in their bedrooms after distance learning? Or are they going, because you can't really do too much in the last 2.5 months. So what is the impact of the pandemic have on the vaping?
Yes. So first, I'd like to illustrate the point of collaboration and why we do this and how we connect. And the way that I always talk to community about it is think of those connect the dot pictures. You connect, there's a series of numbers and it paints a bigger pictures once you connect those dots. The concept of living in drug-free communities is collaboration at its best. So the chief has this vision of how we can connect all those dots. And when you design a picture of drug-free communities, you have to think of every dot being a possible intervention, being a possible agency that can collaborate. You think of the 2Ps and the mental health systems, and then you think about the faith-based community, and you think about all these components, and we start to draw lines between them, and we connect them. And this paints a picture of successful communities with strong collaborations, and it really reduces the risks, and then we try to, through the interventions, to develop as many interventions that end up being protective factors for the community. So that's in the part of collaboration. How can we continue to do that, especially during COVID-19 and this social isolation and the kids being basically, this distance learning concept? Well, it's actually a great opportunity in the world of prevention. This is an opportunity like we've never had before, because guess what? Home is not just home. Home is a huge classroom. Home is a community center. Mom is not just mom. Mom is a teacher. Mom is a nurse. Mom is a counselor. Mom and dad have a lot of influence and control over what's being done at home at this moment. So who is our best partner right now to establish some prevention at home?
The parent.
The parent. Where is our best bet? Who is our strongest partner? How many dots will connect if we get families involved in the process of reducing underage vaping?
So thank you, Mirza. My question to you real quickly, we'll come back to that, is, Chief, what are some of the signs at home that parents might overlook or not see that are watching right now and might want to know about students, or our students and their children vaping or tobacco or any sort of substance abuse?
Right. And I think that's a really good question to kind of segue from what Mirza was saying about the role of the parent wearing multiple hats. One of the other hats that a parent should be is a parent should be the first one to be the overseer, the direct overseer, or to police your own home. I would rather be the parent that polices my own home rather than to call the police to come in. I would want to be the first investigator in my own home rather than to call for someone else from the outside. So I would say that parents need to be cognizant of what is going on and have that sixth sense that as children have a tendency to want to do things, but parents should be very intuitive about what's going on with their children. Parents should already be talking to their children and having that ongoing relationship of daily communication with their children, so that many things won't come as a surprise to them because they're being the observer. They're observant as far as changes in behavior. They're observant as far as changes in attitude with their children, and they're tuned in, and so they're constantly showing that concern. When children should grow up with the understanding that parents will be checking and inquiring about who your friends are, where it is that you want to go, finding out who the other parents are of the other children, so that you know not only who your child is at home.
You're telling the parent to be nosy.
To be aware and be concerned, and in a very positive way, be nosy. It lets the child know that my parent cares, that my parent loves me enough to want to ask questions about what's going on in my life. And so I think that parents should check to see what's going on, what's in the room, what's in the closet, and these things, so that parents are aware of what's coming in and out of the home.
Now, growing up in Rialto as a middle schooler and also a high schooler, I used to remember we used to call our parents square, and I was guilty of that as well, because they were, and my father always used to say, perfect paranoia. I'm okay with that. I'm okay if you think you're going to hate me today, but I'm going to help you tomorrow. And now I understand that. And I think sometimes parents who get busy with work, so are there signs, like if you're in the restroom or in your room way too long, because sometimes the child can be in their room for 2 hours. When should a mom or a dad check up on the child?
The parent should always be proactively interfacing with the child, whether they suspect that something is happening or not, so that it should not come as a surprise when the parent knocks on the door, because that's the parent's behavior, that they are just being parents. They're
Right.
just being good parents. They're just being proactive parents. So the child should always be suspecting this. But if the child is asking to always want to be alone, yes, that is a sign. If the child does not want to engage with the rest of the family and participate in family outings and family activities,
So the behavior is a big factor of
that
that
is
as
a
well.
sign that the child wants to be alienated or estranged from the family activities. And so that would definitely be a red flag to the parent to ask the question, what is it and why is it that my child does not want to participate as much in family events and activities, whereas the child once upon a time was that way? That's the same is true of school. If a child was once getting good grades in school and then all of a sudden the grades start to drop, that's an indication to the parent that something is wrong, because the child is disengaging within their own personal education.
Now, if something like that happens, can our parents contact you? Do the parents contact? Because like you mentioned, which was great, the last resort is you want to go to the police department. In this particular case, you need to get help. You need to get support. So that's when you come in from Central Valley Mental Health Program. What kind of support do you provide parents? Is it counseling? Is it some program that the mother and the child and the father go through, or what is it?
So one of the roles that environmental prevention plays is really the education of parents. You were mentioning before how, by perception, adults right now may be thinking vaping is not an issue. I mean, there's more serious stuff that's happening right now. So they're not aware of the epidemic levels of, the vaping crisis that we're facing. So that itself is giving us data. That itself is telling us this community needs education. They need to know what's in a vape pen, what it is. We're on the 5th generation of vaping devices that now they went from looking like cigarettes to now looking like school supplies. So now we have things that look like flash drives. They look like, different devices that would be associated with school. Yes. So now it's very difficult. These devices could be in front of you and you don't know. So the education is very necessary. But a lot of times, and especially now during this social isolation, it's normal for kids to be in their room, not to be, we're trying to follow all these advice on how we're going to stay safe. Be vigilant of your kids. Now, as an environmental prevention program, our job is to bring parents, educate parents so they can look for those signs, and also educate parents in different types of substances that are out there, to bring them to a level of awareness so they can assess the students, their kids, properly, so that they can understand that, wait a minute, this is not normal. I heard, I was watching this Facebook Live, which is what we're doing. We are reaching families through Facebook Lives, and we talk about signs, and we talk about behaviors that you need to be aware of. And we also talk about things that we can do together to create protective factors at home. In having said that, not just the school district, but the city of San Bernardino, the Department of Behavioral Health, we put those numbers up there for people to call. There's crisis, 1-800 numbers. People are afraid a lot of times because of, issues that are associated with them being undocumented or language barriers.
But that doesn't have anything to do with it. You do have bilingual, and this is not an
Exactly.
immigration issue.
Yes. So
Okay.
the education is so necessary. But guess what? We have the unique opportunity nowadays because everybody is in the social media platforms and very willing. We have so many parents that had never done Facebook Live, that just didn't do any kind of social media. And now they're saying, I see the value. I welcome you into my home and tell me about it. I'm listening because I need to be aware. I need to be educated. And once that happens, that level of awareness will make us notice things that have been there, but we weren't noticing before.
Wonderful. That's great. Chief, a couple questions for you real quickly, and we'll wrap things up. I want to first say thank you so much because I know that in the last 3-4 years under the leadership of Dr. Avila, our superintendent, you had an opportunity to also broaden so many programs, so it wasn't just officers on campus and it's, a rudimentary job. It is innovative. You're doing great things. It's an award-winning educational safety department with restorative justice. Virtual Cafe, what exactly is Virtual Cafe?
I think that Mirza, that comes with the vape program that she's introducing.
Okay, so we're going to let her talk.
I'll let her speak to that one.
So my second part of the question is, what age, and I think this goes for both of you too, feel free to answer, what age should we be looking at? I mean, obviously, kindergarten to 5th, I'm hoping, is not a vaping issue in Rialto Unified School District or anywhere in the nation. But realistically, what age is the influence starting for vaping that you see nationwide and locally in the county?
Yes, and sadly, as a prevention program, we have been very, very sad to see that we've had kids in elementary schools that came to ask for opportunities to do community service because they were caught in possession of a vaping pen.
So you're talking about 8, 9, and 10.
I'm talking about 5th grade students, 4th grade students that have been caught in possession of vaping devices. It looks fun. I don't know if you've seen a commercial where there's a group of little girls vaping. It's all over social media. And they're saying, oh, this is popcorn. This is cotton candy. Let me try that one. And they're passing it around. So yes, the tobacco companies have been, very proactive in ensuring that they're going to have generations, clients that will be there for years to come. So what is this platform that we've created? We talked about data, yes. Right. So how do we capture data in an environment that's safe for people to talk about? What do we do when we sit around the table and we have a cup of coffee and we talk about things that are really, really bothering us? It's a safe environment. So we share and we're comfortable saying, you know what? I don't know. I've never heard of that. Can you explain that to me? So we're creating that environment through a World Cafe virtually. Basically what we do is people have, they make a cup of coffee, a cup of tea, they sit down with us and we have a conversation about what this issue is, what the reality of it is. The first question on the menu for the cafe is always going to be, what do you know? What do you think about vaping? What have you heard? Because we want to know where they're at, and that's where we want to meet them. And then the second question is, what does that look like in your environment? Well, at home, my husband or my son is already vaping, or my neighbor, or I heard this. So then we bring that to the table. We're capturing data. They're telling us what's going on in their community. The third question will always be, what should we do about it? Now let's give you a lot of education and information about what it really is, and tell us what you would like to see in your community for the future. So we design those drug-free communities that we would love to see, and we start connecting the dots. Who draws the dots, and who puts the numbers on the dots? It's information that comes from measurements that we take in the community. The World Cafe captures data. Surveys capture data. So people such as school districts can start putting the numbers on the dots and say, okay, now we need to go to 2, now we need 3, and that's how we design an environment.
Thank you. And I know that you work with Officer Patricia Pat Connors really well, because she is one of our
Yes.
community liaison and does a terrific job with that. So
Amazing.
I wish you great
Amazing.
success with the virtual cafe. And Chief, I want to thank you. Almost 3-decade career in the Rialto Unified School District. Thank you for keeping our students and staff safe. I know that it's a very challenging job and a thankless job, because we always look for that one moment where we say something isn't safe, but we never appreciate the 99.9% when it is safe. So thank you so much for doing that. I know in the pandemic, what is remarkable in the school district is just about every employee became essential, because just because we're not physically there at the school site doesn't mean that cameras can't be looking around for things. And there's always innovative ways to continue to serve. So I thank you both for joining me on this episode of Rialto Bridge. And thank you for joining us. And until next time, I'm Syeda Jafri. We'll see you then.